look at.
Tonight, everything we know about his condition, his treatment, and the concerns of this moment.
I fully expect other people in the White House will certainly have a positive test result.
It's a bracing reminder to all of us that we have to take this virus seriously. It's not going away automatically.
The latest on President Trump's now personal battle against the pandemic. On NBC News Special Report, the President Hospitalized. Good evening, everyone. As we come on the air tonight, the President of the United States is in the hospital. Now, one of the millions of Americans who over the course of the past year have contracted COVID-19, testing positive less than 24 hours ago for the very virus that has dominated and defined his presidency for months. Experiencing what the White House calls mild symptoms, the president was flown by helicopter late this afternoon from the White House to nearby Walter Reed National Military Medical Center. It's a stunning development in a year that has been full of them, a year dominated by a pandemic that has now claimed nearly 210,000 American lives. And almost unbelievably, today's news comes just 32 days before the presidential election. It has been an extraordinary day. A masked Donald Trump gave a thumbs up tonight as he walked out of the White House and climbed aboard Marine One, headed for Walter Reed Medical Center to receive treatment for COVID-19. The president, now one of more than 7 million Americans who have been infected by the disease. It was only last night in a phone interview on Fox News' Hannity that the president revealed he had been tested.
I just went out for a test. They just do it. It'll come back later, I guess.
A precaution, he said, after finding out his top aide, Hope Hicks, had tested positive hours before. Then, in an early morning tweet, he revealed his diagnosis. Tonight, Flotus and I tested positive for COVID-19.
The statement just out. We will begin our quarantine and recovery process immediately. This puts us in all new territory.
With the shock of President Trump's positive COVID tests reverberating around the world, White House Chief of Staff Mark Meadows offered some encouraging news this morning.
He continues to be not only in good spirits, but very energetic. We've talked a number of times this morning.
It's unclear exactly where and when the president acquired the virus. It's been a busy week for him with events at the White House and on the campaign trail. And there's concern tonight about possible complications due to the president's age and weight. But the White House says the president has been in generally good health. The president's opponent, Joe Biden, tweeted that he was praying for the health and safety of the president and his family. From Britain, Prime Minister Boris Johnson, who battled COVID himself earlier this year, expressed confidence in the president.
We all want to send our best wishes to the president and the First Lady, and I've done that this morning, as you can imagine. And I'm sure that they'll both stage a very strong recovery.
Back at home, government officials rushed to get their own COVID tests. Results came in bunches from those inside the administration and out. Vice President Pence was negative. So was Secretary of State Pompeo. Across the political aisle, Vice President Biden and Senator Kamala Harris reported negative tests, too. Chief of Staff Meadows said he was negative, but also gave this sobering reality check.
I fully expect that as this virus continues to go on, other people in the White House will certainly have a positive test result.
As the day wore on, the early positive reports about the president's condition were tempered by word that he had a low-grade fever, according to 3 people familiar with his condition who spoke to NBC News. And Sean Connolly, the president's doctor, said Mr. Trump received a dose of an experimental antibody drug. Even as the political world was shaken by news of the president's condition, Joe Biden headed out to the campaign trail. In Michigan, the former vice president again wished the First family well and added a cautionary note.
It's a bracing reminder to all of us that we have to take this virus seriously. It's not going away automatically.
For his part, Vice President Mike Pence tweeted that he and his wife were praying for the Trumps' full and swift recovery. And by the end of a chaotic day in an already chaotic campaign, another Twitter message, this one from the president himself.
I think I'm doing very well.
Nonetheless, doctors at Walter Reed Hospital will continue to monitor the president. Our chief White House correspondent Hallie Jackson was at the White House when the president lifted off for the hospital just over 4 hours ago. Hallie, what's the latest on the president's condition?
Lester, he is at Walter Reed now. He is at the hospital. And here's what I can share as far as our reporting on how the president is doing tonight. The White House continues to say that he is in good spirits and has mild symptoms. But what do those symptoms really look like? Sources familiar tell us the president is running a low-grade fever and that he's tired. He's frankly fighting fatigue. That's according to the White House physician. This is a symptom that we've seen from countless other coronavirus patients that we've talked to on these broadcasts, on others, the tired factor. And that is something the president is feeling. You can see him walking out to Marine One earlier today, just before he lifted off. The question that has been consuming much of the day has been, if the president tested positive, the president walking out with White House Chief of Staff Mark Meadows, who else in his circle is also potentially positive? What are these other tests that you're seeing? We can now confirm tonight that the president's son and daughter-in-law, Eric and Laura Trump, are saying that they have tested negative for the coronavirus. This is significant because on Tuesday night, President Trump traveled, of course, to that debate in Cleveland, Ohio. He was with a number of friends, family members, aides and advisors, and his kids, Eric and Laura, all of his adult children, had joined him. Another one of his sons, Don Jr., was out on Fox News this evening talking about this. He said he spoke to his father this morning. He says his dad rarely gets sick. Don Jr. saying that he believes that his dad will pull through and fight through this here. When you pull back, there's also some new information that we're getting tonight, Lester, about who has tested positive that had interactions with President Trump at any point when he was at the White House. And things are starting to center, at least from our reporting tonight, on an event that happened just about a week ago. I was in the Rose Garden for this event last Saturday when President Trump revealed his Supreme Court nominee, Amy Coney Barrett. This was an outdoor event in the Rose Garden. We have now learned that at least 6 people at that event have now tested positive. That includes President Trump and First Lady Melania Trump. It includes Senator Mike Lee. It also includes Senator Tom Tillis, we've confirmed tonight. Their offices saying that those 2 senators have tested positive. The president of Notre Dame was at the event, tested positive as well. And we're now hearing from the White House Correspondents Association that a journalist covering the event also tested positive, Lester. So these are some of the threads that we're following tonight as this story, frankly, continues to develop and will do so over the next several days.
Yeah, alarm bell still ringing tonight. All right, Hallie, thank you. Walter Reed National Military Medical Center, just outside Washington, is one of the nation's premier military hospitals. It has had presidents as patients before, but never under quite these circumstances. NBC's Kelly O'Donnell saw President Trump arrive there this afternoon. She is there with us for us tonight. Kelly, what can you tell us about the president's treatment he'll be receiving?
Good evening, Lester. At this point, out on the street here outside of Walter Reed, there is a magnet for interested parties, critics of the president and some of his supporters. On the corner behind me here, for the last hour or so, there are Trump supporters who've been waving flags. There's been a lot of noise here on the street, not ideal for a patient who is trying to get some rest. There have been horns blaring and a lot of activity as people are drawn here because of the president's arrival. At Walter Reed, what the president gets is something that is different than every other patient. It's a different kind of facility, and it's one that is rarely used because it's reserved only for a president. And seldom have we seen our presidents hospitalized. The complex of rooms that belong to the presidential suite include not only a place for the president to sleep and rest and get medical treatment, but there are also office spaces and a conference room so the business of government can carry on there, and also a separate kitchen so the president's food can be carefully monitored. All of those features provide security. This is a military base involving several of the branches, both Navy and Army and so forth, and it is a place with complex medical equipment and expertise. So the president will have a team of experts who are treating him here. And it also provides a difference from caring for himself or to be cared for at the White House in the executive residence, where civilians would be potentially exposed. The White House staff, for example, many of them serving for decades in the White House, are civilians who would not have the medical knowledge and could be exposed to active coronavirus inside the White House residence. Also, law enforcement and Secret Service and political appointees who would interact with the president. So here, by coming to Walter Reed early and staying at least a few days, the president will get the combination of security, medical care, privacy, and a chance to carry on his duties, which is very important for the White House, very important for a president who's just 30 days away from an election. So tonight, he is the first patient, and he's the commander-in-chief being cared for by the military's finest medical professionals. Lester?
All right, Kelly O'Donnell, thanks. We'll let you step back from that traffic there in a busy intersection. Thank you. We learned today President Trump was given a dose of an experimental antibody treatment for his COVID infection, a medicine manufactured by Regeneron Pharmaceuticals. Here to tell us more is that company's co-founder and chief scientific officer, George Yancopoulos. Dr. Yancopoulos, thank you for being with us today. Can you explain how this antibody cocktail therapy works against the virus?
Yeah, essentially, we all know that when you get infected with the virus, it's a race between the virus and your body's immune system to try to see who wins. And the people whose immune system lose that race get sicker and could unfortunately get hospitalized or even worse and die. If your immune system is very robust, it can win that race. What our technology does is it delivers the antibodies that the immune system normally produces, and it gives them at very high doses into these patients. It can substitute, replace, or supplement your own immune system, and in that way help you win that race against the virus.
You released some data earlier this week. What did it show?
Well, importantly, we should just point out that this is not, this is a tried and true approach. We probably have produced some of the world's most important medicines using this approach over the last 10 years, including the fact that this is not our first epidemic. We use exactly this approach to develop a very effective treatment against Ebola, which will hopefully be approved actually this month by the FDA. So there's a lot of reason to have hope in this approach initially, and that's why I think a lot of people have been following our work at Regeneron ever since we initiated it back in January. But what you're referring to is just this week, we announced some very important clinical trial results. And in those results, we showed something very important that hasn't been shown by any other treatment that's been tried against this virus, a strong antiviral effect. That is, in the patients who we think might be at highest risk, whose body has the highest viral levels, we could reduce virus in a few days by 99%. So, of course, if you're fighting a virus, if we can supplement your immune system with this immune system out of a vial, and we can drive your virus levels down 100-fold in a few days, that should give you better chance to win the race against the virus. And in fact, the early clinical endpoints in the study looked positive. Patients were recovering about twice as quickly in small numbers in the trial. So it is still early results, but I think the track record of this approach together with the results from this clinical trial, I think are reason to have a lot of hope.
Yeah, it sounds very promising. Now, is it the president was receiving this therapy essentially within less than 24 hours of his diagnosis? Is it more effective to give it to someone like him right out of the gate?
So for sure, that's what we showed with Ebola, that the earlier you get it, Ebola is a much more universally lethal disease. If you gave it early enough, you can get over 90% survival in what is otherwise could be almost a universally fatal disease. So for most of these diseases, if you can supplement or replace the immune system earlier rather than later, it should give you a better chance to win the race and beat the virus.
All right. Well, George Yancopoulos, thank you. You're doing important work. We appreciate you spending some time with us tonight. And much more ahead, including some new information tonight on how the COVID-19 virus spreads. And I'll talk to more medical experts about what might be in store for President Trump in the hospital tonight. Hope you can stay with us. headlines can be hard to understand, and a lot of kids have questions. So we started a newscast for them. We hope your family will watch Nightly News Kids Edition.
You got to get a four-year degree, but a four-year degree is super expensive. We have created a system where the ticket to the middle class is a thing that middle-class families have to stress about and borrow for and patch together.
Why is this happening? With Chris Hayes. Subscribe now.
For breaking news in our changing world, download the NBC News app.
Protests broke out. The coronavirus pandemic.
The story.
Emergency approval to treat COVID-19 with plasma. Many questions remain about how well it works.
From every angle.
How much of the increased tension was due to the militias that came here?
On the ground.
Deadly western wildfires in California.
Entire communities were also wiped off the map.
And in depth.
One of the big concerns is indoor air quality. What are you doing to address that?
NBC Nightly News with Lester Holt.
Firefighters have had more favorable conditions, allowing them to push the flames away from homes, but the wind can change all of this on a dime.
We can continue to expect protests as people continue to call for more answers to what happened and continue to call for that accountability.
Starting to feel like a typical general election. Both candidates actually out on the campaign trail making their pitch to voters.
The moment to truly understand who we are and who we say we are is right here at our feet.
President Trump's diagnosis and hospitalization has focused even more attention on a subject that has preoccupied the country for months: the speed with which COVID can spread when people are indoors close together. And there's a growing body of knowledge about just how it spreads. With more on that, here's Tom Costello.
From the small offices in the West Wing to the plane to the indoor debate hall, experts say the environments were not unlike Americans' workplaces, schools, sporting events, and restaurants. Controlling COVID is all about limiting the amount of virus in the air. Droplets from a sneeze linger in any room with poor ventilation. The particles slowly spread in a thick but invisible cloud, enough virus to make others sick even 5 minutes after a sneeze. But with a ventilation system, those droplets thin out quickly. Within a minute, they get sucked up by the air intake vents. The fewer droplets, the less virus in the air to make people sick. Open windows increase the clean air flow. Harvard professor Joseph Allen is an expert on building ventilation systems.
What's the takeaway for family dinners and restaurants and going out?
When people are in a bar or restaurant, they're eating or drinking, which means masks are down. So not only are you generating more aerosols, this is what makes these a higher risk environment compared to when you're outdoors or in a place with masks on and speaking quietly.
Infectious disease experts say someone gesturing and yelling, as President Trump did on Tuesday, could transmit droplets up to 20 feet and more. The good news for airline passengers: modern aircraft with HEPA filters now offer some of the cleanest air you can breathe. Still, a sneeze or cough can travel at least 2 rows forward and backward. All the more reason to always wear a mask. The president and first lady's diagnoses come as COVID cases are rising again, especially in the Midwest. 20 states report at least a 25% increase. Nationwide, nearly 210,000 deaths, with projections of 370,000 by year's end.
And I think it's going to make Americans realize we're still in the middle of this pandemic. Too many politicians have been saying we're rounding the corner, we're almost done. We're not. We have a ways to go.
That is Tom Costello with that. I want to go back to our chief White House correspondent, Hallie Jackson, who has some new reporting just coming in. Hallie, what have you learned?
Just tonight, Lester, we are learning that the president's former top aide, Kellyanne Conway, is now confirming that she has tested positive for coronavirus. Conway tweeting just moments ago here that she tested positive tonight. She says her symptoms are mild. She has a light cough, that she is now beginning a quarantine process in consultation with physicians as well. And she says her heart is with everybody affected by this global pandemic. It is our reporting that Conway had been involved in debate prep, Lester, ahead of the president's debate performance in Cleveland earlier this week. She recently left the White House at the end of August, actually. She stepped away to focus more on her family. She also, Lester, was at the White House on Saturday, the event that we talked about, the confirmation the revelation of the nomination of Judge Amy Coney Barrett by President Trump, that event in the Rose Garden there. So as we talked about, this is contact tracing that is happening by White House officials. It is the ripple effect now, not just the president's inner circle, but who else this might affect. And now this is, frankly, a significant positive test, given that Conway is, of course, somebody who is a confidant to President Trump's. Lester.
And Mark Meadows, chief of staff, had kind of telegraphed this earlier when he suggested we would see more positive cases, correct?
This is not the end of it, Lester, and I think it was significant that Congressman Meadows said that. Sure.
All right. Well, we have a group of medical experts now to help us understand what the president is up against tonight. NBC News medical correspondent John Torres, virologist, epidemiologist, and NBC News contributor Dr. Joseph Fair. Also with us is NBC News medical contributor Dr. Vin Gupta. Great to have you all here. Let me start with Dr. Gupta. We just spoke a moment ago to the chief science officer at Regeneron about the importance of early treatment. But if you're my doctor and I call you and I say, you know, I've just tested positive, I've got a little bit of cough, I've got a little bit of a fever, would you ask me to go to the hospital or would you tell me to just self-monitor at home?
Good evening, Lester. I would definitely tell you to self-monitor at home based on what you that use case. No one's doubting the potential and the promising early data on less than 300 patients for this antibody cocktail that Regeneron is producing. Regeneron is filled with world-class scientists that have done a lot in the way of clinical advances. So no one would want an advance to hit the market more than ICU doctors across the country, much less the country. We welcome that, but right now there's still very early data. There's frankly other interventions like convalescent plasma, where you could argue you have more data. If you gave the president a higher concentration dose of convalescent plasma, perhaps. In talking to experts, immunologists in the last few hours, perhaps that would have been the more evidence-based option as opposed to going for this experimental antibody infusion. And so that's the concern here. It causes confusion. And taking a step back, Lester, why are we doing it? What is concerning about the president's lab results or clinical presentation that is prompting such an aggressive approach? Usually when we say let's give an anti-inflammatory agent or convalescent plasma, we're getting a series of lab work. We're making clinical decisions based on data. It would be nice if they shared that.
All right, interesting. Dr. Torres, let me ask you, while the president is under observation right now, what will doctors be looking for over the next 24 to 48 hours?
And this is going to be a critical time for him because typically what happens here, if you remember, day one, no symptoms. Day two, he started having mild symptoms. If it's mild or moderate, then everybody kind of takes a deep breath and says, okay, we're good at that point. But once it starts hitting that moderate to severe category, that's when things start getting concerning. And like was mentioned earlier, he has a couple of risk factors that are not in his favor for fighting the disease. But number one, what they're going to do is they're going to be looking at those symptoms, see if they start worsening. If they do start worsening, they're going to do what they can to try and get that under control. Like Dr. Gupta was talking about, he already got the Regeneron polyclonal antibodies there. They might start looking at remdesivir. They might start looking at other medications. And they'll certainly do oxygen support if he needs it. But the main point is being at the hospital here, being at Walter Reed, he has the ability to have a staff around him 24/7 that can monitor him constantly. And if things do start changing and they start changing rapidly, they can get on that very quickly and they can start doing what they need to do to try and keep it as controlled as possible. And like we've seen in the past, sometimes these patients go from feeling kind of a little under the weather to all of a sudden they're in the intensive care unit, they're on a ventilator, and that can happen very rapidly. We hope that doesn't happen here, but he is right now at the best place if that does tend to happen, and he's getting the best care at this moment. So hopefully that sees him through the rest of these days. These next 5 days or so, those are going to be the critical days, Lester.
Dr. Farrell, let me ask you, we have continued to hear more names of people infected, possibly who all attended the same event. When does the window close? In other words, people who might have been at these events, at what point can they feel a little better?
I think really, they're going to want to keep testing for, really up to 5 days to really feel in the clear out of this. It's not just going to be that first test that's negative that says you're negative and you're in the clear completely. As we saw with the president, he had a test earlier that was negative and then he later tested positive. So everyone in that circle, everyone in that staff, and all of the associates of that staff, everyone they came into contact with, they're really going to have to fit into that same category and be tested continually over the next few days.
And Dr. Gupta, it's beginning to sound like not all tests are the same in terms of their reliability. Is that part of the issue here right now, that people are being diagnosed with tests that may not give always accurate results?
I think that's one of the concerns, Lester, is what reporting has suggested that the White House continues to rely on the Abbott ID Now technology. Abbott produces a lot of fantastic technologies. I would say the Abbott ID Now has come into disfavor. Some clinical studies at NYU, for example, suggest a really high false negative rate. That means, say, if 10 people are truly positive for COVID-19, that Abbott ID Now test might miss 3 or 4 of them potentially. So it's just not a good test. So it begs the question, was that initial test on Hope Hicks before the debate, was that a true false negative, or was she incubating the virus and was she just not, was her body not actually truly infected at that point? There are vastly better tests on the market right now, and so that would be, it would be important for the White House to tinker their approach and to look for something else if they want a rapid point of care testing capability in addition to the lab-based capability, which is the gold standard.
All right. Well, gentlemen, thank you very much for your expertise and sharing your knowledge. We're going to move on now to Chuck Dodd. If the years were hurricanes, 2020 would be a Cat 5, and it's not over yet. The news of the president's infection and hospitalization came fewer than 3 days after a presidential debate like no other, and just 32 days before the presidential election. This is all, of course, uncharted territory. To help us navigate it, let's turn to NBC News political director and moderator of Meet the Press, Chuck Todd. Chuck, help us unpack this.
Well, it's interesting. I was just thinking of that cliche that we all use, uncharted territory, and it feels almost as if we're underselling where we are. I mean, look, this is uncharted waters. We've not dealt with something like this before, but I think the immediate impact is that the campaign is in sort of a pause mode right now. I mean, I think that everything is a bit on hold. What does that mean? Okay, right now for 7 to 10 days, right? We don't know how long the president is going to be off the campaign trail. And the thing is that the campaign itself, while it's going to go on, to me, it feels like it's going to be in suspended animation. I mean, you're really not sure. We see the Biden campaign has pulled all of their negative ads right now. I wouldn't be surprised if the tone of the campaign sort of also has this pause mode. But then what is the debate going to look like next week in a VP debate if the president is currently in the hospital? Is that a time that the vice president should be traveling the country? Maybe he should be staying at the VP residence. So these are all the things that I think short term we don't really have good answers for. And I think when you start to say, where are we right now? This is what I mean. I think there's a lot of unknowns just in the next 4 or 5 days.
I think a lot of people may agree with you. All right, Chuck, thank you. We're back in a moment with more on what the president's illness means for the campaign ahead, including those scheduled debates Chuck mentioned, when we continue in just a moment.
Watching NBC News Now. We've got some breaking news.
If they do go back to their jobs, they want to make sure that they are protected.
It's news made for your streaming world. Live weekdays starting at 6 a.m. Eastern.
By mail, early in person, or on Election Day.
Each state has its own set of rules for the way we cast our ballots.
Yes, it's a little confusing. That's why we have to figure it out now.
Plan your vote.
Firefighters have had more favorable conditions, allowing them to push the flames away from homes, but the wind can change all of this on a dime.
We can continue to expect protests as people continue to call for more answers to what happened and continue to call for that accountability.
Starting to feel like a typical general election. Both candidates actually out on the campaign trail making their pitch to voters.
The moment to truly understand who we are and who we say we are is right here at our feet.
You got to get a 4-year degree, but a 4-year degree is super expensive. We have created a system where the ticket to the middle class is a thing that middle-class families have to stress about and borrow for and patch together.
Why is this happening? With Chris Hayes. Subscribe now.
For breaking news in our changing world, download the NBC News app.
This morning across the country, what the new normal for schools will look like.
Many teachers left making tough choices between the job they love and their family.
What am I going to decide? Take care of my children or have a job?
That's an impossible decision.
You're creating a little community school. This is a moment where we can just develop ourselves and develop our community.
Let's turn it over to students. How do they really feel about returning to school?
What I miss is my teachers.
They are resilient.
Today's headlines can be hard to understand, and a lot of kids have questions, so we started a newscast for them. We hope your family will watch Nightly News Kids Edition.
The person leveling the accusations isn't me, it's John Bolton. I have heard from sources, and you guys have reported, that Dr. Fauci, through Secretary Azar, had been banging the pots and pans very early in the year. I worked on campaigns. If that was a campaign event, it was a crummy one.
Deadline White House is now 2 hours. Weekdays from 4 to 6 on MSNBC.
Protests broke out. The coronavirus pandemic.
The story.
Emergency approval to treat COVID-19 with plasma. Many questions remain about how well it works.
From every angle.
How much of the increased tension was due to the militias that came here?
On the ground.
Deadly western wildfires in California.
Entire communities were also wiped off the map.
And in depth.
One of the big concerns is indoor air quality. What are you doing to address that?
NBC Nightly News with Lester Holt.
By mail,
Early in person,
or on Election Day.
each state has its own set of rules for the way we cast our ballots.
yes, it's a little confusing. That's why we have to figure it out now.
Take 15 minutes and plan your vote.
ASAP. In some places, the polls are already open. Go! Make sure your voice is heard.
Plan your vote.
Plan your vote.
Plan your vote.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
That was the 18-second message from President Trump sent out on Twitter late this afternoon. Let's turn again to Chief White House correspondent Hallie Jackson. Hallie, what do we expect this weekend?
I can tell what we expect tomorrow, Lester, which is frankly not much. The White House has put out the guidance for President Trump, and he obviously has no public events. I can imagine that he will be laying pretty low in the hospital, staying behind, potentially behind closed doors, although it is significant that the White House brought the president out for that video that was released that we just talked about, saw him walking on and off Marine One, the helicopter that carries him to and from places when he was leaving the White House and getting to Walter Reed tonight. The White House clearly wants to put in place this optical position that the president is still in command. That is the messaging that we have been hearing from White House aides. And part of the reason, I think, that you saw the president so publicly take that walk to the helicopter, take that walk off when he got to Walter Reed, as we're showing some of the images here, is to essentially work, in the White House's view, to try to reassure the American public that the president is still able to be the president and do the work of the American people and carry that out. I imagine, Lester, and I would anticipate potentially that because we have seen several memos today from the White House physician, that may be something that continues throughout the weekend as well, that the correspondents, the White House reporters who cover this building and this president will receive updates from the president's doctor. We know the Chief of Staff, Mark Meadows, traveled to Walter Reed with President Trump. He spoke with reporters today, as we've noted earlier in the broadcast. And if possible, I know that reporters would want to hear from the Chief of Staff again in the coming days to get updates on how the president is doing and truly what his condition is, because that is the question mark here. Will these mild symptoms continue to be mild, Lester, or is that something that may change over time? Lester.
All right. Hallie, thank you. Joe Biden shared a debate stage with President Trump just 2 nights before the president tested positive. Biden tested negative today and made a previously scheduled campaign stop in Michigan. But it's clear that at least for now, there will be no more politics as usual for either candidate. For more on the state of the race, let's bring in White House correspondent Kristen Welker. Kristen.
That's right, Lester. Former Vice President Joe Biden hit the pause button on the partisan political rhetoric today. He did make that campaign stop in Michigan, made it very clear that he had been tested twice and that he has tested negative. He really put the focus at the start of his remarks on President Trump, on the First Lady, and said that this moment underscores just how seriously we have to take this virus. Take a listen to what he had to say in Michigan.
Sending my prayers for the health and safety of the First Lady and President of the United States after they tested positive for COVID-19. My wife Jill and I prayed that they'll make a quick and full recovery. This is not a matter of politics. It's a bracing reminder to all of us that we have to take this virus seriously.
Now, the Biden campaign is taking down its negative political ads for the time being. We did hear a similar message from one of Biden's top surrogates, former President Barack Obama, who held a joint virtual fundraising event with Senator Kamala Harris. Take a listen to what Mr. Obama had to say.
We also want to extend our best wishes to the President of the United States, the First Lady. Michelle and I are hopeful that they and others who have been affected by COVID-19 around the country are getting the care that they need, that they are going to be on the path to a speedy recovery. And it's important, I think, for all of us to remember that even when we're in the midst of big political battles with issues that have a lot at stake, that we're all Americans and we're all human beings.
Now, of course, former President Obama and President Trump are bitter political rivals, so it underscores the enormity and just how remarkable this moment is that President Obama is really taking a step back from that. So is former Vice President Joe Biden. What does this mean for President Trump? For his part, his campaign has suspended any events that he had scheduled. They are hoping to be able to resume some of those events virtually as soon as possible. Vice President Mike Pence, who tested negative, is planning to resume campaigning. And I am told at this point, they are planning for the vice presidential debate to go on as planned next week. But as Chuck was saying, this is really a day-by-day event. So clearly the White House will be watching and monitoring the situation quite closely. And the president's health is the most important thing. President Trump loves campaigning. Of course, he was out on the campaign trail a lot of times at events where a number of people weren't wearing masks, where he wasn't wearing a mask. But we know that he really feeds off of that type of energy. So it is the anticipation of his campaign and those around him that he is going to be eager to start campaigning virtually as soon as possible, as soon as he turns the corner on this virus. Lester.
All right. Kristen Welker, thanks very much. We sometimes like to say that our senior Washington correspondent, Andrea Mitchell, has seen it all before. But Andrea, I don't imagine you've ever covered a story quite like this before, all that happening a month away from the election.
incredible. Just 32 days from the election, the president announcing at 1 o'clock in the morning this morning that he had tested positive, and then, of course, the news later today that he was going into Walter Reed. It is so extraordinary also because the White House has frankly not been very forthcoming with information. We got a very brief statement from the White House physician saying that he was suffering from fatigue and that he had mild symptoms, but not very much else. And also talking, of course, about that antibody cocktail, the compassionate use, which hadn't even been approved as an experimental, but is approved if patients in need it and want to take it. So, and they believe that there's not much risk from it and that there could be indeed a benefit. But the fact is that there was no briefing. In the past, we've always seen doctors coming out, whether it's the doctor telling us at the White House briefing that the president is suffering from such and such and is going into hospital or having surgery or having a scheduled procedure, or at the military hospital itself. We've all been up there in the briefing room getting those briefings. Nothing from the physician himself, other than that brief statement. That is unusual. There's been really a lack of transparency about President Trump's medical records all along. When he was the candidate, he was one of the few candidates in recent memory nominees who did not put out his full medical history, just that brief written letter and a rather unusual letter from his personal physician, who later claimed that the president had dictated it himself, talking about the president's excellent health or the candidate's excellent health. And then, of course, very little recently from his physical. There was an unusual trip last November to Walter Reed, unscheduled on a Saturday afternoon. They said then that it was the first part of his annual physical, which didn't make sense. Then they said it was for routine blood work and other lab tests. Then later in June, they put out a statement on his physical and some more detail, but not a whole lot. And he does have some indications, higher risk, comorbidities, his weight, 244 pounds, his age, 74 years old, and that does increase the risks. And so that can be disturbing. He has a pre-diabetic disposition, not diabetes, but a predisposition for diabetes. That can be really troubling for COVID patients as well, and some high blood pressure as well, some high cholesterol. So he's in a high-risk category, and they should have, I believe, for the sake of the country, been more forthcoming, but clearly that is not the way of Donald Trump. Also, there's been a lack of communication to Democrats in particular. Very surprising to a lot of people in both sides of the aisle that there was no communication to Nancy Pelosi, who is third behind Mike Pence, of course, if there were, under the worst of circumstances, some sort of succession. And she only heard about it on the news when the rest of us did.
And Andrea, let me ask you, we've talked a lot about mask wearing around the White House, which we don't certainly see from the angles that we're able to view. But describe the inner workings of the White House. It's such a grand and obviously historic building, but my impression are the quarters are rather tight when it gets down to the worker bees.
Absolutely, and you know that very well. Certainly the Situation Room, the corridors between the Oval Office and the Chief of Staff's office, they're all really narrow, the steps that go down to the Situation Room. And so you're coming up against people, and this is very disconcerting for the staff. Hallie Jackson was talking about that earlier. It's been a troubling day, a sobering day for them. And the fact is that there's very little mask wearing. They say that Hope Hicks was one of the few people who on the helicopter in the past and in other circumstances at meetings would be wearing masks, but most of the others have not. And it's certainly the indications from those who've come out of the White House Health Task Force, Olivia Troy, who was speaking to us and has been very outspoken about her concerns, that only Dr. Birx, Dr. Redfield, of course, Dr. Fauci, they wear masks always coming into the White House and during the meetings unless they are speaking. But the president doesn't like it. He has chastised reporters for wearing masks, as all of our correspondents do in the briefing room. He's chastised them for wearing masks, asked correspondents recently to take off their masks when talking to him. He's really ridiculed it, as he has ridiculed, Joe Biden just Tuesday night at the debate. And so even though this is the public health guidance of his own CDC, he is ignoring it and not showing the right example, people say. And certainly that was the case Tuesday night of his family, under the flouting the requests the regulations of the Cleveland Clinic.
All right, Andrea Mitchell, thank you. Today's news was a reminder that when an American president is hospitalized, the shockwaves are felt around the world by friend and foe alike. For more on the national security implications of all this, let's turn to Jeremy Bash, who served in the Defense Department and the CIA under President Obama. Jeremy, good to see you. When the president was finally seen today, getting on the chopper, standing there, making that short video, how important a message was being sent in your view?
Well, all world leaders were watching that video very carefully. They were trying to assess whether there is stability atop the U.S. government. Now, the president out at Walter Reed National Medical Center at Bethesda tonight, he does have the communications ability. He does have the secure phones to remain commander-in-chief, to give any orders that he must give to the intelligence community or to the military. But I think there are two concerns. Number one, Lester, if his situation deteriorates and he is incapacitated, like Boris Johnson, the prime minister in the UK, had to go into intensive care, if something like that happens to the president, of course, then Mike Pence would become acting vice president. Now, this has happened 3 times in recent history, once under President Reagan, twice under President George W. Bush. But in all 3 of those situations, those were anticipated medical procedures where the president was under anesthesia. And there was a written document certified by the Attorney General and the White House counsel that formally transferred power to the vice president. Here, tonight, we are in a gray zone, Lester. We're in a situation where we don't know which is the tipping point when the president's situation might deteriorate so that he has to turn over powers to Mike Pence. And then secondly, the concern is that an adversary might try to do something. If they sense that there's uncertainty atop the U.S. government, they might try to do something militarily, something provocative, and an escalation could happen very quickly.
Yeah, I would think that I would hope that our government would be very forthcoming and honest about the president's condition as things may or may not change along the way. But might there be reason for the government to want not to do that, especially if things began to go south?
Well, I think what the government will want to do is transmit clarity. They'll want to be very clear. The president has the ability to make decisions or he does not. And if he does not, there's a formal chain of command. There's a formal way to convey the duties of the office of the president to an acting president. What we don't want to have is any gray area, any ambiguity. That's going to be the signal to our adversaries, a potential green light that they may try something, and that would be catastrophic for the country.
All right, Jeremy Bash, always good to talk to you. Thanks for coming on. We'll return in a moment with a look back at a wild week and some final thoughts from someone who can help give us a little perspective on the stunning events of this day. Today's headlines can be hard to understand, and a lot of kids have questions, so we started a newscast for them. We hope your family will watch Nightly News Kids Edition.
You got to get a 4-year degree, but a 4-year degree is super expensive. We have created a system where the ticket to the middle class is a thing that middle-class families have to stress about and borrow for and patch together.
Why is this happening? With Chris Hayes. Subscribe now.
For breaking news in our changing world, download the NBC News app.
Protests broke out. The coronavirus pandemic.
The story.
Emergency approval to treat COVID-19 with plasma. Many questions remain about how well it works.
From every angle.
How much of the increased tension was due to the militias that came here?
On the ground.
Deadly western wildfires in California.
Entire communities were also wiped off the map.
And in depth.
One of the big concerns is indoor air quality. What are you doing to address that?
NBC Nightly News with Lester Holt.
Firefighters have had more favorable conditions, allowing them to push the flames away from homes, but the wind can change all of this on a dime.
We can continue to expect protests as people continue to call for more answers to what happened and continue to call for that accountability.
Starting to feel like a typical general election. Both candidates actually out on the campaign trail making their pitch to voters.
The moment to truly understand who we are and who we say we are is right here at our feet.
By mail, early in person, or on election day.
Each state has its own set of rules for the way we cast our ballots.
Yes, it's a little confusing. That's why we have to figure it out now.
Take 15 minutes and plan your vote.
ASAP. In some places, the polls are already open. Go! Make sure your voice is heard.
Plan your vote. Plan your vote.
Plan your vote.
We want to check back in with NBC's Kristen Welker on the impact this news may have on Capitol Hill. Kristen?
Well, Lester, this could be setting up a battle on Capitol Hill. Republicans do want to move forward with the confirmation process of the president's nominee for the Supreme Court, Judge Amy Coney Barrett, despite the fact that now 2 members of the Judiciary Committee have tested positive. Senator Tillis, of course, as well as Mike Lee of Utah. Now, Democrats are saying, look, the fact that this has happened means that the entire process should be paused. This is what Chuck Schumer had to say. He said, we now have 2 members of the Senate Judiciary Committee who've tested positive for COVID, and there may be more. I wish my colleagues well. It is irresponsible and dangerous to move forward with a hearing, and there is absolutely no good reason to do so. Here's the bottom line, though, Lester, as long as Republicans feel as though they have the votes, they will likely move forward with this process, and they can do so virtually. They can start to hold hearings virtually. And so from the perspective of Republicans on Capitol Hill, they don't think that what has happened, these developments they are obviously watching quite closely, should hold up the confirmation. Having said all of that, Lester, if there are more positive cases, that could change the equation. So that's certainly something that they will be eyeing. In addition to that, it's worth noting that there's sort of been this deadlock over another COVID relief package, and it is possible that that package is still going to move forward. Negotiations between the Speaker of the House, Nancy Pelosi, as well as Treasury Secretary Steven Mnuchin, and there's a sense that they have been making some measured progress and that they're not ruling out a potential deal even against this backdrop. So a lot happening on Capitol Hill. The backdrop to all of this, though, Lester, there are going to be new discussions about safety measures that are in place, testing that some people are calling for in order to make sure that when members do become positive, they're not infecting other lawmakers on the Hill. Lester.
All right, Kristen, thank you. This has been a day, a week, a year like no other. For those of you watching the news and for those of us bringing it to you, these are indeed challenging times. We asked Dennis Murphy to recap a week that defies description.
A week of whiplash, one tumultuous event after another. It was just days ago, but feels like months, as the nation mourned Justice Ruth Bader Ginsburg. It seemed that the final weeks to the election would be consumed by the fight to seat her nominated successor before November 3rd.
Judge Amy Coney Barrett.
The conservative Justice Amy Coney Barrett would be in the confirmation hurricane. But the eye of the hurricane had already shifted from court politics to an exclusive story about President Trump's taxes in the New York Times. And before all those accounting numbers could be absorbed, the world spun again, because Tuesday was debate night. After the debate, word that the president's closest advisor, Hope Hicks, had tested positive for COVID. Then, in the early hours this morning, Brian Williams broke in with startling news. The president himself had COVID.
President of the United States has tested positive for COVID-19.
The president ill with a virus that had killed more than 200,000 Americans. One he once predicted would be gone by summer. A week full of twists and turns, emblematic of a year of crisis, ranging from COVID upending the country to social justice forcing us to face our past. Fires and hurricanes threatening our future. This year, 2020.
How to process a day or a week like this? Well, it helps to have a Pulitzer Prize-winning historian to turn to, and we do. John Meacham joins us. John, how are you taking in this day in this year of 2020? I keep thinking we should put a countdown clock to the end of 2020 on the screen.
Yeah, we should. You know, it's been a year and an age of distrust and disease, and the two are related, tragically, in the American experience at this point. We are in the midst of, I hope we're toward the end of it, but we're certainly in the midst of an age in which we have very little trust in the institutions that have marked, in many ways, the channels of our lives. We distrust expertise. We distrust political leadership. We distrust the word of science and fact, because too often we've allowed our reflexive tribalism to overcome the capacity for reason to govern our choices, both in our personal lives and in the public arena, which leads you to the disease part. There is an inexorable connection between the capacity of reason, the efficacy of reason in making decisions in our lives, that creates a better health for us and a better health for the nation itself. You know, in 1968, 3 British journalists wrote a book about that tumultuous year of assassination and 46 Americans dying every day in Vietnam, the remarkable performance of George Wallace in the presidential election that year. And they called it an American melodrama. Right now, we're in an era of an American drama, and we don't yet know how the drama ends.
Yeah, all these things, though, they don't necessarily fit in the same bucket, but we tend to put them there because they give us this raw feeling of just something's not going right, that the wheels are falling off the bus. At the end of the day, is it about trust in our institutions?
It certainly is, because it's about trust, and I would argue, with all respect, that they're inextricably linked. Why has the pandemic spread so decisively here and not elsewhere in the world? Because a number of Americans have chosen to reject expertise, to reject the advice and counsel of scientists. And many of those people who rejected the advice and counsel of scientists are people who were willing 4 years ago to send a disruptive actor to the pinnacle of power. So our distrust is in the ability of reason and authority, not top-down authority, but those who study these matters, those who give their lives over to the process of wear a mask, right, socially distance. Why haven't more Americans trusted that counsel? Why hasn't the pinnacle of American leadership promulgated without fail and without ambiguity that scientific counsel? And it's because of a kind of narcissism, it's a kind of self-indulgence, and those things are rooted in a dark American tendency, and it's perennial, but sometimes it ebbs and sometimes it flows, and right now it's flowing, a tendency not to want to be told what to do. But sometimes, when we're advised what to do, we should do it.
Fair point. All right, John Meacham, great to talk to you. Thank you. Before we go, let's check back with Kelly O'Donnell at Walter Reed Hospital, where President Trump is being treated tonight. Kelly, what's ahead for the president there?
Well, certainly you would expect that the president needs some rest and some treatment and a quiet night. A very different scene outside here at Walter Reed National Military Medical Center, where there has been a constant parade of protesters, political on all sides of the spectrum, some in support of the president. And we would expect over the weekend that that this secure facility will give the president that rest and treatment and an opportunity to be in touch with advisors and to keep the government running. All of that happening. What is unclear to us is how much we'll learn about the president's condition over the weekend, not being at the White House, but being at a military hospital with the commander-in-chief as the #1 patient. So Lester will be monitoring this over the weekend. It has certainly drawn attention on a night when the president probably needs some quiet and some rest. Lester?
All right, Kelly, thank you. That concludes our coverage for now. Thank you for joining us as we navigate a story that truly has no end in sight. The pandemic that laid this country low has now stricken its president just as a long and bitter campaign enters its final weeks. We're at a place we've never been before, but we'll get through it together, and we will be here to follow it with you every step of the way. I'm Lester Holt in New York. For all of us at NBC News, good night and stay safe, everyone.
Watching NBC News Now. We've got some breaking news.
If they do go back to their jobs, they want to make sure that they are protected.
It's news made for your streaming world. Live weekdays starting at 6 a.m. Eastern.
This is NBC Nightly News with Lester Holt.